Welcome to the State of Kansas Employee Health Benefits Enrollment Presentation for 2025. The State Employee Health Plan, SEHP, provides a comprehensive benefits package allowing you the opportunity to elect the options that best fit your personal situation. The information provided in this presentation is a general overview of offered benefits before you make your coverage selections. It is not intended to cover every specific benefit or exclusion. For additional benefit information, such as an electronic version of the 2025 Enrollment Guide booklet, 2025 Enrollment Resources, Benefit Descriptions, the State Employee Health Plan Benefit Guidebook, and links to forms you may need, visit the State Employee Health Plan, SEHP, website at healthbenefitsprogram.ks.gov. During this presentation, we will cover your health plan benefit options, the Health Quest Wellness Program, the Employee Assistance Program, the enrollment process. We'll also review available educational and decision-making tools to help you make the best benefit selections for you and your family. Finally, we will provide you with important resources and contact information should you have more questions or need additional information. Now, let's see what's new for 2025. In 2025, for medical and prescription coverage, there are no increases in the current medical premiums for employees. For Plan C and N, the first deductible for members with non-single coverage will be $3,300 to meet IRS regulations. However, the overall family deductible will remain at $5,500. For dental coverage, there are no increases in the current dental premiums for employees. Dental premiums remain a zero-cost item for employee-only coverage. The annual benefit maximum for dental benefits will increase to $2,000 per member. The orthodontia lifetime benefit maximum will increase to $1,500 per member. For voluntary prescription eyewear insurance, Surancy will be the vendor for the voluntary prescription eyewear program in 2025. We will review those benefits later in this presentation. We want to make sure you're aware of the importance of network providers. The SEHP vendors offer broad provider networks. Each vendor's provider directory is available through the State Employee Health Plan website, as well as on each vendor's website. Before you enroll in benefits, we encourage you to review these directories to see if providers used by you and your family are in one or both networks. Once you enroll, you are not able to make changes until the next open enrollment period, or unless you experience a qualifying event. Network providers save you money. By receiving services through a network provider, you will only be billed for your applicable deductible, coinsurance, or copays, and will not be balance billed for amounts over the allowed charges. If you use non-network providers, you could be responsible for balance billing for any amount more than the plan allowance. The State Employee Health Plan offers medical coverage for active state employees, early retirees, and non-state employer groups through two different medical vendors. The vendors are Aetna and Blue Cross and Blue Shield of Kansas. Regardless of the medical vendor you choose, all State Employee Health Plan medical plans offer the same comprehensive benefits. All medical plans include Caremark prescription drug coverage, preventive services, telemedicine options, preferred lab benefits, and access to the Health Quest Health Center. All medical plans offer the same coverage for eligible preventive care services and follow the Affordable Care Act guidelines for preventive care coverage. Regardless of which medical plan you choose, these services are covered at 100% without having to pay a deductible or coinsurance when services are received from a network provider. Preventive care coverage includes services such as your annual well exam, age-appropriate cancer screenings, immunizations, hearing exam, and an annual eye visit. The benefit descriptions for each medical plan provides information about eligible preventive services and are available on the SEHP website. Your provider must bill services with the appropriate preventive coding for these benefits to apply. Preventive services received by non-network providers are subject to the non-network deductible and coinsurance provisions of your selected plan. Before we begin reviewing the medical plans, here are some key terms you will hear and their definitions. Premium. This is the amount that you pay via payroll deduction, typically semi-monthly, for your SEHP insurance plans. Deductible. A fixed dollar amount you must pay each calendar year before the plan begins reimbursing for eligible expenses. Individual deductible. The individual deductible applies separately to each covered person in the family. When a person's deductible expenses reach the individual deductible amount, the person's deductible is met. Family deductible. The family deductible applies to the family as a group. When the combined deductible expenses of all family members reach the family deductible, the family deductible is met. Coinsurance. Once you meet the annual deductible, you and the plan share in the cost of covered medical expenses. This is called coinsurance. When you use network providers, your out-of-pocket is less than if you use non-network providers. Copay. A fixed amount you pay for a covered healthcare service each time a service is received, for example, a doctor's visit. A copay amount may vary by the type of covered service. Out-of-pocket maximum. The most an employee could pay during the plan year for their share of the costs for covered services, including copays, coinsurance, and deductible. Out-of-pocket maximum, or OOP, does not include costs for services not covered by the plan, over-the-counter medications, or amounts over the allowed charge. Once you have chosen your preferred medical vendor, you will need to select which medical plan will work best for you and your family. The State Employee Health Plan offers 4 different medical plans, and all include Caremark prescription drug coverage. These plans have different premiums, deductibles, coinsurance levels, and out-of-pocket maximums. Plan A is a more traditional plan which includes copays for office visits. Plan J meets the requirements for J-1 visa employees. Plans C and N are qualified high-deductible health plans, which means these plans meet all federal requirements to allow you to have access to a health savings account or health reimbursement account. The next several slides outlining plan benefits can also be found in the 2025 Employee Guidebook. Now, let's review each of these plans in more detail. The first plan we'll review is Plan A. Plan A is a traditional preferred provider organization. This type of health plan contracts with medical providers, such as hospitals and doctors, to create a network of participating providers. You pay less if you use providers that belong to the plan's network. However, you may still use non-network doctors, hospitals, and providers for an additional cost. With this plan, your office visits when using a network provider are subject to the corresponding copays before the deductible. Your copays, deductible, and coinsurance apply until your out-of-pocket maximum is met. Then the plan will pay for covered services at 100%. Non-network office visits and services would be first paid by you until your deductible is met. Once the deductible is met, the plan shares the costs of covered services with you, also known as coinsurance. Once you reach your designated out-of-pocket maximum, the plan pays covered services at 100% of the plan's allowed charge. The network and non-network deductibles, coinsurance, and out-of-pocket maximums accumulate separately. Let's review the prescription coverage with Plan A. Members on Plan A have first dollar coverage for prescription drugs subject to coinsurance. Your pharmacy expenses are not applied to the Plan A medical deductible. However, the coinsurance you pay for your prescriptions does apply to your overall out-of-pocket maximum. Once your out-of-pocket maximum has been met, the plan pays for covered drugs at 100% of the allowed charge. Plan A is also the only plan that offers special pricing for diabetes and asthma medications. Members on Plan A who use specialty medications will be able to use the Prudentar X program to obtain these specialty medicines at zero cost to the member. You can earn the HealthQuest Premium Incentive Discount, and we will talk more about this in a bit. HRA, HSA, and HealthQuest Reward Dollars are not available. Next is Plan J. Plan J meets all federal requirements for employees with J-1 visas, but is available to all members. For covered services, you would be responsible for the cost until your deductible is met. Once your deductible is met, the plan will then share the cost of covered services with you, also known as coinsurance. You will be responsible for your coinsurance amounts until your out-of-pocket maximum, OOP, is met. Once you meet the out-of-pocket maximum, the plan pays for covered services at 100% of the allowed charge. On Plan J, your network and non-network deductibles, coinsurance, and out-of-pocket maximums accumulate separately. For prescription coverage, members on Plan J are responsible for 100% of the discounted prescription cost until the deductible has been met. Then you will share the cost of prescription drugs with the plan through coinsurance until the annual out-of-pocket maximum is met. then the plan pays for covered drugs at 100% of the allowed charge. You can earn the Health Quest Premium Incentive Discount, and Plan J also includes a Health Reimbursement Account, HRA. With this account, you have the opportunity to receive employer contributions and earn extra contributions by participating in the Health Quest Wellness Program. We'll talk about this more in a bit. Next are Plans C and N. These plans are qualified high-deductible health plans, or QHDHPs, which means they meet federal requirements and have a higher deductible than a traditional insurance plan. The monthly premium is usually lower, but you pay more healthcare costs yourself, also known as your deductible, before the plan shares costs with you. Due to Department of Treasury guidelines, the deductible for members with single coverage on these plans will remain at $2,750. For all other levels of coverage, employee spouse, employee family, and employee children coverage tiers, the first deductible will be $3,300, and the rest of the family deductible of $2,200 will apply to the remaining family members, for the same total family deductible of $5,500. For covered services, you would be responsible for the cost until your deductible is met, except for preventive services. Once your deductible is met, the plan will then share the cost of covered services with you, also known as coinsurance. You will be responsible for your coinsurance amounts until your out-of-pocket maximum, HOOP, is met. Once you meet the out-of-pocket maximum, the plan pays for covered services at 100% of the allowed charge. On Plan C and Plan N, your network and non-network deductibles, coinsurance, and out-of-pocket maximums accumulate separately. For prescription coverage, members on Plan C and Plan N are responsible for 100% of the discounted prescription cost until the deductible has been met. Then you will share the cost of prescription drugs with the plan through coinsurance until the annual out-of-pocket maximum is met. Then the plan pays for covered drugs at 100% of the allowed charge. Members on Plan C and Plan N using specialty medications will be able to use the Prudentar X program and receive these drugs at zero cost after they meet their deductible. A high-deductible health plan can be combined with a health savings account or health reimbursement account, allowing you to pay for certain medical expenses with money free from federal taxes. You can earn the Health Quest Premium Incentive Discount on Plans C and N, and you have the opportunity to earn extra contributions to your HRA or HSA by participating in the Health Quest Wellness Program. We'll talk about this more in a bit. Telemedicine is a fast, easy way to see a doctor. You can visit with a live doctor anytime, anywhere using your computer, tablet, or phone. All state employee health plan medical plans include coverage for telemedicine services. Telemedicine doctors can treat a variety of conditions, including cold, flu, fever, rash, sinus infection, pink eye, ear infection, behavioral health, and more. Aetna offers members a telehealth service through Teladoc, and Blue Cross and Blue Shield of Kansas offers a telehealth service through Amwell. These network providers apply to the regular provisions of each medical plan. The Health Quest Health Center, our employee clinic, also offers telehealth services to all health plan members over the age of 2, covered by SEHP medical insurance. Marathon Health Anywhere is a virtual care platform that provides access to a dedicated care team of primary care providers, behavioral health specialists, and health coaches. Telehealth doctors don't replace your primary care physician, but this benefit offers a less expensive alternative to urgent care or ER visits and more convenient accessibility. The types and providers of services may vary when using telemedicine, and some costs may vary depending on the type of care being provided and which medical plan you have. Restrictions on telemedicine services are listed on the SEHP website, and your deductible, coinsurance, or a copay may apply to a telemedicine visit. You may easily register for telemedicine services by simply visiting the medical vendor's webpage on the SEHP website. Your medical coverage automatically provides prescription drug coverage through CVS Caremark, and the cost is included in the health plan rates. While the preferred drug list is the same for all plans, the amount you pay varies depending on your selected plan. Once you set up an account at caremark.com, you can find the preferred drug list from your personal portal, or you may access it on the SEHP website under Caremark. You may also access the Check Drug Cost tool to determine if your prescription drug is covered and what it will cost under your plan. As we reviewed earlier, the amounts you pay for your prescriptions accumulate toward your combined OOP maximum for medical and prescription coverage. Regardless of which plan you choose, your prescription costs will be lower if you use generic or preferred brand name drugs. Home delivery is available through CVS Caremark. Specialty and biotech drugs are available exclusively through the CVS Caremark Specialty Pharmacy. Contact Caremark Connect and they will coordinate patient care with the provider and arrange for medication delivery. Please visit the SEHP website for additional information about the prescription drug benefits. Prudent Rx Specialty Medication Program is available for members using specialty medications. CVS Caremark has collaborated with Prudent Rx exclusively for a program to help save you money when you fill eligible specialty medications. This program offers a savings opportunity when using specialty medications through CVS or Caremark. Prudent Rx allows members to see immediate savings on their specialty medications. Caremark Specialty Pharmacy partners with Prudent Rx to enroll members in available manufacturer copay assistance programs. Plan A members will benefit by receiving their specialty medications at zero cost, since the copay assistance will apply. Plan C, J, and N members will benefit by receiving their specialty medications at zero cost after they meet their deductible. Prudent Rx is a voluntary program. You can choose to opt out at any time. However, if you are taking a specialty medication and choose not to participate in the Prudent Rx program, the 30% coinsurance will apply for the member share. How to get started. Your enrollment in the program will begin automatically, but additional steps may be needed. A Prudent Rx trained member advocate will assist you in completing the enrollment and getting started in the program. You will receive a welcome letter from Prudent Rx, which provides information about the Prudent Rx solutions as it pertains to your medication. For any questions or additional information about this program, contact Prudent Rx at 1-800-578-4403. A valuable prescription benefit for SEHP members is the transparency tool offered through Rx Savings Solutions. This confidential, easy-to-use tool helps you find opportunities to save money on your prescription medications. Once you register, Rx Savings Solutions will automatically review each prescription and notify you by email, text, or phone to alert you if there is a possible savings opportunity. They will handle everything to request a change to a lower-cost medication by contacting your doctor and pharmacy on your behalf. You may log on to their site to learn more or call and speak to a pharmacy technician about your options. All medical plans include preferred lab benefits through Quest Select, Stormont Vail Health, and the University of Kansas Health System. This benefit provides significant discounts towards many covered lab services and saves you money on out-of-pocket expenses. The preferred lab benefit is completely voluntary. If you and your healthcare provider choose to use a lab other than one of the preferred lab vendors, you still have lab coverage through your medical plan. By selecting to use one of the preferred labs vendors, members will receive a discount. Members on Plan A who use one of these preferred lab vendors will receive 100% benefits on many of the most common diagnostic lab services without having to meet a deductible or coinsurance requirement. Members on Plan C, J, and N, your lab costs have again been significantly discounted. The discounted costs for lab service will be applied to your deductible until your deductible is met. Then, covered lab services are paid at 100%. If you select Plan C, J, or N, you will have either a Health Reimbursement Account, HRA, or a Health Savings Account, HSA, through MetLife. Now, let's look at each option in more detail. A health reimbursement account through MetLife is available if you are enrolled in Plans C, J, or N. With a health reimbursement account, the state employee health plan contributes money into your account on your behalf, which you may use to pay for unreimbursed medical, dental, and vision expenses per IRS guidelines. HRAs are funded only by employer contributions, so you do not contribute to them. For your contributions, you may use the flexible spending accounts. HRA funds must be used each year, as any remaining balance in your HRA does not roll over to the next year and will terminate if your health plan enrollment ends. You have 60 days from December 31st to file claims for expenses incurred during that plan year. If you have an HRA, your employer contributions for each plan are as illustrated here. Employer contributions to an HRA are made quarterly for active state employees and monthly for non-state employer groups. For new enrollees, HRA contributions will begin the quarter after your enrollment. In addition, employees have the opportunity to earn additional contributions through participation in the Health Quest Wellness Program. To receive Health Quest rewards dollars, you must have an active paycheck. For full details and information on your HRA and the eligible expenses for reimbursement, visit the SEHP website. A health savings account or HSA through MetLife is available to you if you are enrolled in plans C or N. An HSA is a tax-advantaged account designed for a person with a high deductible health plan and includes contributions from your employer and from you, the employee. Per IRS policy, to qualify for an HSA, you must meet all of the following stipulations. You must be enrolled in a high deductible health plan, Plan C or Plan N. You may not be enrolled in Medicare, including Part A only, Medicaid or TRICARE. You may not be claimed as a dependent on someone else's tax return. You may not be enrolled in another non-HDHP qualified plan. You may not have a medical flexible spending account. Limited purpose FSA is available. If you meet the requirements and enroll in Plan C or Plan N, you may have an HSA. Your employer will contribute to your HSA on your behalf on a quarterly basis for active employees and a monthly basis for non-state employer groups. To receive the scheduled employer contribution when you're on Plan C, you must contribute a minimum amount of $25 per pay period or $50 per month. If you are on Plan N, you are not required to contribute to receive the employer contribution to your HSA. In addition to the employer contributions and your contributions, Employee Health Quest rewards dollars will also be deposited into your HSA. The IRS sets the maximum contribution limit on HSAs each year. This maximum limit includes contributions made by the SEHP and your earned Health Quest rewards dollars. It's important you count all contributions, both employer and employee, to the maximum to avoid exceeding the IRS limits. These maximums are household limits and include any contributions your spouse may make to their own HSA as well. For 2025, those limits are: single, $4,300; family, $8,550. In addition, if you are age 55 or older, you may make an additional catch-up contribution of $1,000 each year. With an HSA, the funds belong to you. As funds accumulate in your HSA, you will have additional investment options available. Your money goes with you even after you leave employment, since it belongs to you. Here are the HSA employer contributions for each plan for 2025. As a reminder, with Plan C, you must contribute $25 per pay period or $50 per month to receive the employer contribution. With Plan N, you do not have to make any contribution to receive the employer contribution. For full details and information on your HSA and the eligible expenses for reimbursement, visit the SEHP website. Next is dental coverage. The SEHP offers dental coverage through Delta Dental Plan of Kansas. The dental plan available to you is a standalone benefit, which means you do not have to be enrolled in medical coverage to select dental coverage. The dental plan is the only benefit that is covered at 100% by the employer for employee-only coverage. The dental benefit consists of one plan utilizing both of Delta Dental's nationwide networks, Delta Dental PPO and Delta Dental Premier. You will receive higher benefit levels when using the Delta Dental PPO network. The calendar year deductible for the dental plan is $50 per person, not to exceed $150 for a family plan. The deductible does not apply to the diagnostic and preventive services of the plan. There is a maximum calendar year benefit of $2,000 per person. This amount is the maximum the plan will pay on your behalf for covered services in a calendar year. There is a lifetime maximum benefit for orthodontic services of $1,500 per person. This amount is the maximum the plan will pay on your behalf for covered orthodontic services in a lifetime. Here is a summary of your benefits through Delta Dental Plan of Kansas. Again, there is a single plan with multiple levels of coverage. The enhanced level of coverage applies when you have received at least one dental exam or cleaning in the prior 12 months. The basic level of coverage applies when you have not received at least one dental exam or cleaning in the prior 12 months. New enrollees in the dental plan automatically receive the enhanced level for their first 12 months of coverage. When dentists agree to become part of Delta Dental's PPO or Premier Network, they agree to accept established fees for services and cannot charge you the difference from the agreed-upon fee. Non-network dentists have not agreed to an established fee for service. Therefore, any amounts in excess of Delta Dental's established fee for service is the member's responsibility when seeing a non-network dentist. Shornsey will administer the voluntary prescription eyewear benefits. Shornsey Vision is proud to partner with iMed Vision Care to provide you with one of the largest, most diverse networks in the nation. Access your Shornsey member account by visiting shornsey.com/state of Kansas, or from your phone by downloading the free Shornsey mobile app. Here are a few things you can do easily online or by using the mobile app once you create your member account. Search for network providers and participating retailers. View the basic and enhanced benefit summaries. View your benefits, eligibility, and claims. Order glasses and contacts online. Submit claims for reimbursement. Estimate out-of-pocket costs. Print a replacement ID card. Use your mobile ID card through the Shornsey mobile app. Access special offers for member-only savings. Shopping online. For contact lenses, benefits can be used at contactsdirect.com. For frames and lenses, orders can be placed online and shipped to your home for free. Learn more about this network savings benefit by visiting glasses.com. If your provider is a network provider for your eye exam, but does not participate with Shornsey, you may take your prescription and go to a network provider who contracts with Shornsey in your area to fill your materials order, or use your prescription online through contactsdirect.com or glasses.com and order your eyewear materials at network benefit levels. In 2025, Shornsey is the new vendor for the voluntary prescription eyewear plans. When enrolling, you may select between the basic or enhanced plan. The basic plan includes coverage for one pair of standard eyeglasses or contact lenses. The enhanced plan includes everything the basic plan offers, plus a higher frame allowance and coverage toward lens enhancements, which also includes a new benefit enhancement for progressive lenses, no line bifocals. Members may use their benefit for contact lenses or spectacle lenses once per year. However, the member's frame allowance can still be used if contact lenses are elected. You can use the contact allowance throughout the year and doesn't need to be used all at once. For a complete list of covered services when using a network or non-network provider, please review the plan description available on the State Employee Health Plan website. The enhanced plan has coverage for progressive lenses. The standard or Tier 1 to 3 progressive lens will have a $25 copay. The Tier 4 progressive lens will have a $25 copay with a $165 allowance towards the purchase of the lenses, and any cost above the Tier 4 allowance will be the member's responsibility. Your provider can help you determine what tier of progressive lens may apply to your situation. More detailed information about the progressive lens benefit can be found on the State Employee Health Plan website. For members covered by the SEHP medical plans, your first eye visit, regardless of reason or diagnosis each year, is covered at 100% under your medical insurance when you use a network provider. You will need to present your medical card to your provider at the time of service to receive your full benefit. You may check to see if your eye exam provider is part of your medical network by visiting the medical vendors provider network listing linked from the SEHP website. MetLife is your carrier for the 3 voluntary benefit plans offered. Voluntary benefit plans offer you additional resources when you're confronted with unusual or unexpected circumstances. These plans pay you cash to help offset unexpected expenses due to an accident or illness and are separate from your medical coverage. Voluntary benefits available to you include accident insurance, which helps offset unexpected costs due to an accidental injury; hospital indemnity insurance, which provides a lump sum benefit in the event of a hospital stay; critical illness insurance, which provides a lump sum benefit to offset costs due to specified critical illnesses. Non-state employer groups. Check with your employer to verify if your group offers this coverage. The State Employee Health Plan also offers 5 options for flexible spending accounts, also known as FSAs, and they are administered by New Synergy. By enrolling in an FSA, you will have the ability to contribute funds from your paycheck on a pre-tax basis to your FSA to pay for qualified expenses. These funds may be used, as defined by the IRS, for out-of-pocket medical, dental, and vision expenses, dependent care expenses, and parking or mass transit expenses. Because these contributions are on a pre-tax basis, you save money by reducing your annual taxable income. As always, please consult a qualified financial professional regarding your specific circumstances. FSAs have a use it or lose it rule. What this rule means is you must use the expenses in your FSA by the end of the calendar year or forfeit any amount above the established rollover amount. Each October, you must make a new election to participate during the open enrollment period. Your new enrollment election becomes effective January 1. Please consult our SEHP website for updated 2025 FSA maximum contribution limits. The 2025 Enrollment Guide reflects the maximum payroll deduction amounts based on a January 1st effective date. Non-state employer groups. Check with your employer to verify if your group offers this coverage. The 2024 annual maximums for the medical, dental, and vision healthcare FSA and the limited purpose FSA are $3,200. The 2024 FSA maximum contributions are shown because the 2025 IRS maximums have not been published at this time. The SEHP has established a rollover provision per IRS regulations. Rollover means that up to $640 of funds in either of these two accounts may be carried over to the next calendar year. The healthcare FSA is available to people enrolled in Plans A or J, and people enrolled in Plan C and Plan N who have an HRA. This account allows reimbursement for qualified medical, dental, or vision expenses not covered by insurance. Common expenses for the healthcare FSA include copays, prescriptions, eyeglasses, dental services, and orthodontics. The limited purpose FSA is available to people enrolled in Plans C and N who have a health savings account. The limited purpose FSA works the same as the medical, dental, and vision FSA, but when you have an HSA, your limited purpose FSA covers only dental and vision expenses per IRS guidelines. The flexible spending accounts are available to active state employees. Non-state employees will need to check with their specific employer regarding the availability of these benefits. The Dependent Care FSA allows reimbursement when a dependent under the age of 13 or adult dependent is physically or mentally incapable of self-care. Common dependent care costs include daycare centers, before or after school care, and adult daycare centers. The family maximum contribution is $5,000 per year. Funds in a dependent care FSA do not roll over to the following year. However, for active employees, the dependent care account does allow participants to incur expenses up to 75 days through March 16, 2026, after the end of the calendar year, and continue to use funds from the previous year's dependent care account. The deadline to submit dependent care claims against your 2025 plan year balance is April 30th, 2026. The Mass Transit FSA and Parking FSA maximum is $315 per month. Any unused funds that remain in your account at the end of the year will be carried over into the next plan year if you continue to participate in the plan. The Mass Transit FSA allows reimbursement for qualified mass transit tickets or passes like the bus or State of Kansas van pools. Toll fees, including KTAG charges, are not eligible expenses. The Parking FSA allows for reimbursement for parking associated with your daily commute. If your employer currently deducts your parking expenses pre-tax, you will not need this option. Again, the flexible spending accounts are available to active state employees. Non-state employees will need to check with their specific employer regarding the availability of these benefits. The Health Quest Rewards Program is a wellness incentive program offered by the State Employee Health Plan that promotes health and wellness through incentives and information. This program is available to all employees and spouses covered by the medical plans through the State Employee Health Plan. Participants who complete activities that promote physical, mental, and emotional wellness earn credits towards premium discounts and/or HRA/HSA reward dollars. Participation in Health Quest programs is always voluntary and strictly confidential. Visit the Health Quest webpage for additional information about activities to earn incentives and to enable your account. The premium discount is available to members of all medical plans, A, C, J, and N. To receive the premium incentive discount, only the employee needs to earn credits. Employees need to earn 40 credits to receive the full premium incentive discount. Employees on Plan A who have been employed for a minimum of 365 days who earn 20 to 39 credits can receive a partial premium incentive discount. You have until December 31st to earn your 2025 premium discount. If you are enrolled in Plans C, J, or N, you may also earn $12.50 in reward dollars for each Health Quest credit, up to $500 per employee. These reward dollars are contributed into your HRA or HSA when you earn them. You have until November 14, 2025 to earn HRA HSA rewards. To ensure you are receiving your reward dollars, be sure to activate your Health Quest account at healthquest.ks.gov. For a complete list of activities available to earn Health Quest reward dollars, visit the Health Quest portal through the SEHP website. Contracted through Marathon Health, the Health Quest Health Center offers healthcare screenings, sick care, health coaching, chronic condition coaching, and counseling services. Visit the SEHP website for a list of services offered through the Health Quest Health Center. The Health Quest Health Center is open to all employees, spouses, and dependent children over age 2, covered by SEHP medical insurance. Preventive visits, including immunizations and health coaching, are free regardless of health plan enrollment. Plan A, healthcare services are provided at no cost. Plans C, J, N, medical and behavioral health visits are a $40 fee per visit until your deductible is met. Available services include healthcare screenings, sick care, health coaching, chronic condition coaching, counseling services, blood work and lab tests, virtual care. The Health Quest Health Center is located at 901 South Kansas Avenue in Topeka, Kansas. The clinic hours are Monday, Wednesday, and Friday from 7 a.m. to 4 p.m. and Tuesday and Thursday from 9 a.m. to 6 p.m. Schedule an appointment for in-person or virtual care by calling 785-783-4080 or by visiting the Marathon e-portal. You need to bring or show your health insurance ID card and a photo ID. If you're enrolled in Plan C, J, or N, any medical services not related to preventive care require a $40 fee due at time of service until your deductible is met. Marathon Health Anywhere is a virtual care platform that provides statewide access to a dedicated care team of primary care providers, behavioral health specialists, and health coaches. Marathon and the SEHP recently introduced a short video on the Anywhere program that you can share with your employees or use in team meetings. It is available on the SEHP website. Anywhere appointments can be scheduled Monday through Friday from 7 a.m. to 5 p.m. with nurse triage available from 5 p.m. to 7 a.m. Central and is accessible by calling 785-783-4080 or by visiting the Marathon Health e-portal. For Plan A, medical and behavioral services are provided at no cost. For Plan C, J, N, medical and behavioral visits require an all-inclusive $40 fee per visit until your deductible is met. For additional information, visit the SEHP website. The Employee Assistance Program, or EAP, is offered through ComPsych at no additional cost as a confidential service for employees and their families for benefits-eligible employees. This program is available to all active benefit-eligible employees of the state of Kansas and our non-state employer group, their family members living in the same household or dependent children, whether or not they are enrolled in the medical plan. Benefits-eligible employees who have been laid off are eligible to use the EAP for up to 6 months after a layoff. Retirees and COBRA participants are not eligible to participate. The EAP provides counseling services, as well as a plethora of other services related to legal and financial issues, finding child or elder care services, hiring movers, home repair contractors, and more. This program also offers toolkits for members about key issues or concerns facing them in today's environment. These toolkits are a great resource to support the well-being of SEHP members and their families. Visit the SEHP website for a list of all the available EAP services. To assist you with your benefit plan selection, the state offers ALEX. ALEX is our online interactive coverage comparison tool and is available on our website to help you determine which plans and benefits might best suit your needs for the upcoming year. ALEX offers many interactive features including a chat option and ALEX Go, a simplified access point for members. By answering a few simple questions, ALEX will guide you through all the SEHP benefit programs and help you determine which benefits to select. ALEX is an optional support tool to help you in choosing benefits. All benefit enrollments must still be completed through the Membership Administration portal. Open enrollment is the entire month of October. All employees covered under the medical insurance will need to re-enroll for 2025. New employees whose coverage is effective in October, November, or December of 2024 will need to complete 2 separate enrollments through MAP. One enrollment will be for the balance of 2024, and the other enrollment will be for the 2025 plan year. Benefit elections are made using the Membership Administration portal known as MAP. You may visit MAP anytime during the month of October to complete your enrollment. You may visit MAP as often as you wish, and when you complete your enrollment, you will receive a confirmation notice. What do I need to do? Open enrollment for plan year 2025 will be an active enrollment. Active enrollment means all active employees will need to log into MAP and make their open enrollment choices. Once you have made your selections, you will be able to review a summary before you submit them on the Review and Submit screen. When you are satisfied, hit the Click Here to Submit Your Elections button in the lower right-hand corner. A summary of your pending elections will be displayed, and we recommend you print and save this form for your records. We recommend using your personal email rather than a state email address if possible. Note, if you are adding a spouse or dependent to your coverage, you will need to upload copies of the appropriate documentation. You can find a list of acceptable forms of documentation in the Employee Guidebook available on the SEHP website. Important, if you access MAP and enroll in any new plans, you must complete the entire enrollment process. For example, if you access MAP to enroll in dental only, you must actively waive the medical coverage, or you will be defaulted into Plan N for medical coverage. What happens if I don't enroll? Medical coverage. All active state of Kansas employees and non-state group employees who are currently enrolled in a medical plan must make selections for plan year 2025. If you are currently enrolled and do not re-enroll, then your medical coverage will be defaulted into Plan N with your current medical vendor and an HRA for the employer contributions. You will not be allowed to change your plan election until the next open enrollment in October 2025. Voluntary prescription eyewear insurance. Due to changing vendors, members must re-enroll in the prescription eyewear insurance for 2025. Dental only. Members currently enrolled in the dental plan only will remain enrolled for 2025. Voluntary benefits. Members currently enrolled in the voluntary benefits only will remain enrolled for 2025. Waived benefits. Members who have waived coverage in the SAPE will remain waived unless they actively enroll in a plan during open enrollment. FSAs. Members currently enrolled in an FSA will need to enroll annually to keep their accounts active. In addition, state employees with children may qualify for Healthy Kids or the CanCare Children's Health Insurance Program, CHIP. The Healthy Kids program helps eligible active state employees cover the cost of the premiums for their children under the age of 19 enrolled in the SEHP. This program does not apply to non-state employer groups. Eligibility for the Healthy Kids program is based in part on family income. Children in households with incomes who would otherwise qualify for the federal or state Medicaid program may be eligible. Annual application is required. Active state employees wanting to enroll in the Healthy Kids program will need to complete a new application during this open enrollment. CanCare CHIP coverage is available to Kansas children under the age of 19 for all individuals who are eligible to enroll in the SEHP, including state and non-state employees. For most state employees, if your children qualify for Healthy Kids, they may qualify for the CHIP program. If applying for CHIP, you should still enroll your children in the SEHP medical plan until you receive approval for CHIP coverage. For additional information and links regarding these programs, visit the SEHP website. As you make your elections, please note that all plans cover eligible dependents up to age 26 if you have enrolled for dependent coverage. Coverage will term on the last day of the month of their 26th birthday. If you are adding an eligible dependent to your coverage, you will need to submit supporting documentation with your enrollment in MAP. Administratively, the SEHP provides benefits for a newborn child of a covered member for the first 31 days, beginning on the date of birth. However, no benefits will be available beyond that time unless action to enroll the dependent is taken by the member. Within 31 days of birth, the member must submit a mid-year benefit change request form in an AP and a copy of the hospital announcement or birth certificate to add the newborn. The SEHP Employee Guidebook provides a complete listing of the appropriate documentation required to be submitted to SEHP membership services with your online enrollment or change request. For example, birth certificate, adoption papers, marriage license, etc. Appropriate supporting documentation for each dependent is required to verify eligibility and must be uploaded via MAP by using the Upload button at the bottom of the Member Family tab. Documents must be in English and legible, with the enrollment or change request when adding or removing other eligible individuals. Once benefits have become effective, no changes can be made without a mid-year qualifying event or the next open enrollment period. Mid-year enrollment changes must meet the requirements outlined in the SEHP Employee Guidebook. A qualifying event is a recognized family status change such as marriage, divorce, birth or adoption of a dependent, death of a spouse or dependent, gain or loss of group benefits for a spouse or dependent. A qualifying event enables you to make a coverage change during the middle of a plan year, provided the change is consistent with the family status change and the request for the change is made within 31 days of the event and includes the required supporting documentation. Adding or dropping a dependent mid-year is not a qualifying event to change your plan, only the coverage level. Plan changes are only allowed during open enrollment for the next plan year. Refer to the Employee Guidebook on the SEHP website for additional information. Medicare is just around the corner. If you have finally reached the age where you qualify for the Medicare benefits but still plan to work, there's an informational video called Medicare is Just Around the Corner available on the SEHP website. It helps explain the options available and the steps that need taken when reaching age 65. The single sign-on system enables members to access their SEHP benefits and the vendors they've selected directly from their MAP portal. When you are in MAP and click on one of the icons for the vendors, it will take you directly to your personal web page with that vendor. No signing in again or having to remember another password. In MAP, any vendor logo offered on your portal will be available for members to access through one portal. How-to guide for the single sign-on. Step 1. Log into your MAP member portal at https://sehp.member.hrissuite.com. Step 2. On the Member and Family tab, click on the yellow SEHP Vendors button or select the SEHP Vendors tab under Account Overview. Step 3. You will be taken to the SEHP Vendors tab. Any vendor portals available for benefits you are currently enrolled in through SEHP will have an icon listed. Step 4. Once you click on one of those vendor icons, you will be taken to that vendor's portal. Step 5. If this is your first time through the SSO process, follow the steps in the vendor's portal to authorize the SSO connection. After that first-time process, clicking on the vendor's icon will sign you into their portal automatically. Here are helpful tips to help you to be benefit-wise when making decisions about your employee benefits and get the most out of what your employer offers. General tips. Do your research. Before enrolling in any benefits plan, review what's offered and how it applies to you. This might include health insurance options and tax-advantaged accounts. Consider your needs. Think about your current and future needs, such as, are you planning a family? Do you have a lot of medical expenses? Ask questions. If you're unsure about anything, reach out to the state employee health plan for clarification. We have covered a lot of information in this presentation. Should you have any further questions, please contact the State Employee Health Plan. We're here to help. Membership questions. For membership, dependent eligibility, and enrollment questions, email membership services at sehpmembership@ks.gov. Benefit questions. For benefit-related questions about coverage, vendor issues, and understanding your benefits, email health plan operations at sehpbenefits@ks.gov. HealthQuest. For questions related to HealthQuest, email sehphealthquest@ks.gov. Direct bill/retiree. If you are near retirement or considering retirement and want to know what plan options are available when you retire, or have questions about the enrollment process, email sehpdirectbill@ks.gov. Important: when using email addresses above, please remember to provide detailed information, including employee number and current contact information. Specific vendor questions are usually best addressed by the vendor. Here are all the current phone numbers should you need them. When you need to contact any vendor as an employee or providing HR assistance, please make certain you identify yourself as a State of Kansas employee or a member of the SEHP. Nearly all SEHP vendors have a dedicated customer service team for our State of Kansas group, and they will be able to respond to questions more promptly. Additional information can be found on the SEHP website or by contacting any of our specific vendors with your questions. Thank you, and this is the end of our presentation.